So let's get some clarity on how pregnancy happens. To understand infertility, we first need to understand how pregnancy happens normally. Okay, so some steps that are needed for pregnancy to occur include the woman must release an egg, which is known as ovulation. This occurs usually in every cycle, menstrual cycle. Then the fallopian tubes must be open, because the eggs will have to pass through the fallopian tubes for fertilization to occur. Then healthy sperm must meet the eggs in the fallopian tubes for fertilization to then occur. The produce of this meeting, which is the embryo, now implants in the uterus. If there's a problem in any of these steps, then pregnancy may be difficult. So what are some common causes of infertility? One is ovulation problems. One of the most common reasons women struggle to conceive is failure to ovulate regularly or failure to ovulate at all. Some signs of ovulation problems are irregular periods or no period at all. When there is a very long cycle, greater than 35 days, okay, from the first day of the menses to the first day of the next menses, if it's greater than 35 days, then it's a long cycle. When there is excess facial hair, acne, known as pimples, or weight gain, especially excessive weight gain. Some common causes of ovulation problems are polycystic ovarian syndrome, which is one of the leading causes of infertility, premature ovarian failure, when a woman fails to ovulate yet she's still in the reproductive age, when there are hormonal disturbances from, say, thyroid disease, high prolactin levels, or pituitary disorders. These hormonal issues can interfere with ovulation and can prevent a woman from conceiving. So the next is blocked fallopian tubes. The fallopian tubes are where sperm and eggs usually meet. So if the tubes are blocked, fertilization may not happen. Some causes of blocked fallopian tubes include previous pelvic infections, especially repeated infections, sexually transmitted infections, especially repeated sexually transmitted infections, unsafe abortions, previous surgeries, endometriosis, or tuberculosis in some region. Some symptoms that may be suggestive are pelvic pain, especially chronic pelvic pain, painful menstruation, chronic vaginal discharge. An ultrasound scan, what is called a hysterosalpingogram, or a laparoscopy may help to make these diagnoses. The next is endometriosis. Endometriosis occurs when the tissue lining the womb, that's the uterus, is found outside the uterus, and it usually presents with severe menstrual pain, pain during sexual intercourse, or pain during bowel movement, depending on where it is located. Infertility is another thing that is seen with endometriosis. Others are uterine problems. There must be a healthy uterus for implantation and pregnancy to occur. Some common problems that could prevent pregnancy arising from the uterus are fibroids, especially if they cause distortion of the uterine cavity. This is a common condition that is seen with women in the reproductive ages, especially of African descent. The next is polyp. These are small growths inside the uterus that also can interfere with implantation. Congenital abnormalities of the uterus also, when the uterus does not have its normal shape, the cavity is distorted by maybe a septum that divides the uterus, or you have what is called a biconate uterus. There could also be scars from repeated injuries due to repeated infection, or repeated terminations of pregnancy, or a previous surgery. All of this could cause distortion in the uterine cavity that could prevent implantation and subsequently difficulty with conception.